hospitals because of a nurses' strike. The dispute began on Friday over what some nurses claim are unacceptable conditions attached to a recent salary increase. But not everyone in their union agrees.
Striking nurses say their recent pay rise is at the expense of allowances and career opportunities because some senior positions no longer exist. Today, more than 400 nurses at Gladesville and Riverdale decided to remain on strike until Wednesday at the earliest. As volunteers battled on, the decision was supported by 230 nurses at Morisset Hospital near Newcastle. But in a move that has weakened the nurses' case, staff at Macquarie and Rydalmere hospitals this afternoon decided not to join their colleagues. The hardline psychiatric nurses now appear to be out on a limb, determined not to back down, but also anxious to talk out a settlement. For the dispute to go to arbitration, it must be lodged by the Nurses Association or the Public Service Board. And that's where the nurses' problem lies. Their own union has already endorsed the board's salary offer.
If the whole case was taken before arbitration and we were allowed to present our point of view, the nurses most definitely, I feel, would go back to work.
The worsening dispute has left hospitals appealing for more volunteers, especially in mornings and evenings when patients have to be washed, dressed and fed.
I've come in here to do the meals, and I've sort of gone through to the bathing. I've worked on the bathing. That's a bit tough.
While in some cases it's enough to provide a cup of tea or a comforting word, volunteers at Gladesville, where there is no backup emergency team, admit they're starting to feel the pressure.
We need help. We really need help.
Meanwhile, the Victorian hospital system has reached the brink of collapse, with
staff walking off the job in support of striking nurses. The nurses began their strike yesterday over a staffing issue and have now been joined by members of the Health and Research Employees Association. Melinda Smith reports.
There are more than 400 patients at Morisset Hospital and they're being supervised by doctors and volunteers. This morning, members from the Nurses Association and the Health and Research Employees Association joined forces, voting not to go back to work until their staffing demands are met. The nurses say they can no longer provide the quality care needed by the patients.
They know the standards of care they want to give. They're not asking for huge equipment or anything other than other fellow nurses with skills to help them look after, in a team, clients here at the hospital.
The Health and Research Employees Association includes all laundry, domestic, kitchen and outdoor workers. They've walked off the job in support of the nurses, but also in protest at their own staffing conditions.
Patients are affected in regards to the outings they attend, the care they receive. Ward areas aren't being adequately cleaned because we haven't got the domestic staff available to clean all these areas, so the hygiene of the patients are actually suffering within the hospital.
A meeting has been planned between the unions and the management tomorrow. Today, Director of the Administrative Services Tony Ryan said no decision can be made until the hospital's budget is handed down by the Department of Health. That's expected sometime this week. If a resolution is not found tomorrow, the strikers say they'll call on other unions, such as the Public Service Association and trade unions, to support their strike action. Both unions say they want a quick end to the long-running dispute. They say management could solve the problem tomorrow if they granted the staffing demands, but management says its hands are tied because of lack of funding. The ones in the middle of this dispute are the patients, now being cared for by volunteers who are in short supply.
Hospital will decide tomorrow whether or not to return to work and bring an end to the 4-day-old strike. Members of the Nurses Association and the Health and Research Employees Association met with Industrial Commissioner McArdle in Sydney this afternoon in an attempt to end the dispute. Melinda Smith reports.
More than 300 nurses walked off the job on Monday, leaving the 400 patients at the hospital in the caring hands of a small group of volunteers. On Tuesday, more than 100 laundry, kitchen, domestic and outdoor staff joined the striking nurses after a meeting of the Health and Research Employees Association, which voted to support them and protest against their own staffing conditions. The meeting of nurses at Morisset today decided to send a 2-person delegation to Sydney to meet with Industrial Commissioner McArdle. Soon after, a meeting of the H&REA resulted in the same vote. Commissioner McArdle adjourned the hearing pending an inspection next Monday of Morisset Hospital and the staffing conditions. But the Commissioner said the inspection would only take place if all staff, both nurses and auxiliary, return to work immediately. The recommendation will be put to members of both the Nurses Association and the H&REA at union meetings tomorrow. Meanwhile, nurses at Stockton Hospital today decided to rescind the motion not to accept the 10% wage package.
Bringing an end to their 5-day-old strike. The decision was made today after the Industrial Commission called for a return to work to allow an inspection of the hospital next week by Commissioner McArdle. But as Melinda Smith reports, the workers say if their staffing demands aren't met this time, then more industrial action will be taken.
It's now been 5 days since nurses at the Morisset Psychiatric Hospital walked out on strike over staffing levels. They were joined by the kitchen, laundry, domestic and outdoor workers of the Health and Research Employees Union, protesting against their own staffing conditions. Throughout the week, the 400 patients at the hospital have been cared for by only a limited supply of volunteers. A delegation from both unions attended yesterday's Industrial Commission hearing in Sydney, where Commissioner McArdle said that if all strikers returned to work, he'd inspect the hospital next Monday. Both the nurses and the H&REA today agreed to the condition and voted to return to work at 6:30 tonight. But Sub-Branch President John Lockhart says the decision doesn't mean the nurses are giving up their fight.
Oh, by no means are the nurses giving up on this issue. It's quite explicit in McArdle's recommendation that he will be visiting Morisset on Monday, and he will do full inspections, and